Welcome. Today we're diving into a complex autoimmune disorder that often goes undiagnosed: Sjogren syndrome. While primarily known for its effects on moisture-producing glands, Sjogren's can also significantly impact the nervous system, leading to a range of neurological complications. Let's unravel the intricacies of this condition and explore its connection to our nervous system. The exact cause of Sjogren syndrome remains elusive, but scientists believe it stems from a combination of genetic predisposition and environmental triggers. In essence, a person with specific genes may be more vulnerable to developing the disease when exposed to certain viral or bacterial infections. These triggers can initiate an autoimmune response, where the body mistakenly attacks its own tissues. At its core, Sjogren's is an autoimmune disorder. This means the immune system, which is normally designed to protect us from foreign invaders, malfunctions and attacks the body's own cells. In Sjogren's, the primary targets are the exocrine glands, especially the lacrimal and salivary glands. This leads to decreased tear and saliva production. However, the autoimmune process isn't limited to these glands. The nervous system can also be affected through several mechanisms. Firstly, inflammatory cytokines released during the immune attack can directly damage nerve cells. Secondly, the blood vessels supplying nerves can become inflamed, a condition known as vasculitis, leading to nerve damage due to reduced blood flow. Thirdly, antibodies produced by the immune system can directly target and attack nerve tissue. These mechanisms can disrupt nerve signaling, leading to various neurological symptoms. Sjogren syndrome is estimated to affect between 0.5 and 1% of the adult population, making it one of the more common autoimmune disorders. Women are far more likely to be affected than men, with a ratio of about 9 to 1. While it can occur at any age, the typical age of onset is between 40 and 60 years old. It's important to note that Sjogren's often goes undiagnosed or misdiagnosed for years due to its varied and overlapping symptoms. The hallmark symptoms of Sjogren's are dry eyes and dry mouth. Patients often describe a gritty sensation in their eyes, like having sand in them, and may experience blurred vision or light sensitivity. Dry mouth can cause difficulty swallowing, changes in taste, and an increased risk of dental cavities. But the symptoms extend far beyond just dryness. Neurological manifestations are common. These can include peripheral neuropathy, which causes numbness, tingling, or pain in the hands and feet. Other neurological symptoms include cognitive dysfunction like brain fog, memory problems, and difficulty concentrating. Some individuals may also experience migraines, seizures, or even more severe conditions like transverse myelitis, an inflammation of the spinal cord. Diagnosing Sjogren's can be challenging due to its diverse presentation. There is no single definitive test. Diagnosis typically involves a combination of factors. This includes a thorough medical history and physical examination, blood tests to check for specific antibodies like anti-RA-SSA and anti-LA-SSB, and assessments of tear and saliva production, such as the Schirmer's test for tear flow and salivary flow rate measurements. A lip biopsy may be performed to examine salivary gland tissue for signs of inflammation. Neurological evaluations, including nerve conduction studies and MRI scans, may be necessary to assess the extent of nervous system involvement. Sjogren syndrome is generally classified as either primary or secondary. Primary Sjogren's occurs on its own, without being associated with another autoimmune disorder. Secondary Sjogren's occurs in conjunction with another autoimmune condition, such as rheumatoid arthritis, lupus, or scleroderma. There is no cure for Sjogren syndrome, so treatment focuses on managing symptoms and preventing complications. Artificial tears and saliva substitutes are essential for alleviating dryness. Medications that stimulate saliva production may also be prescribed. For more severe systemic symptoms, including neurological involvement, immunosuppressant drugs like hydroxychloroquine, methotrexate, or biologics may be used to suppress the overactive immune system. Pain management is crucial for those with neuropathy, and physical therapy can help maintain mobility and function. In some cases, addressing associated conditions like vitamin deficiencies or thyroid problems can improve overall well-being. Currently, there are no proven methods to prevent Sjogren syndrome. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and stress management, may help to support the immune system and potentially reduce the risk of developing autoimmune diseases. Avoiding smoking and excessive alcohol consumption is also recommended. The prognosis for Sjogren syndrome varies from person to person. Many individuals can effectively manage their symptoms with treatment and maintain a good quality of life. However, some may experience more severe complications, particularly if the nervous system is significantly affected. Ongoing research is focused on understanding the underlying mechanisms of Sjogren's, identifying potential biomarkers for early diagnosis, and developing more targeted therapies to improve outcomes. Emerging research is exploring the role of B-cell activating factor, (BF) inhibitors, and other novel immunomodulatory agents in treating Sjogren's. Furthermore, research into regenerative medicine and nerve repair is offering hope for those with debilitating neurological complications.